My job does not end with just laparoscopic surgery or a minimal access surgery or stress incontinence, which is basically my forte. But I have to see and take a holistic approach towards the patient's well-being.
That why is it that we are having an epidemic of, or rather pandemic of obesity in this world today? You must realize, and now we know scientifically and through lots of research, that obesity is set or decided, or the body fat content of the body is already pre-decided in the womb of the mother. So what it says is that even before you are out of your mother's womb, the cells which are going to proliferate or multiply to make fat cells is already decided. Now the consequences of this bad fat, which is especially, as I said, we Indians are prone to develop that accumulation, is diabetes, blood pressure, cholesterol, heart disease, PCOD, as the doctor has said. Children today at a very, very young age have preconceived notions, whether it is from their nursery, playgroup, friends, birthday parties, and they have their say in the matter. But I would really say that teaching starts in the family. So if family accepts a fact that this is not allowed or does not do it themselves, then obviously it is easier to teach your children. And there are some children or some adults who cannot tolerate mild acidity हो सकता है, कभी किसी को nausea हो सकता है, and worst case scenario में वो loose motions भी हो सकता है. लेकिन it is said that you get used to the side effects. और अगर बहुत ही प्रॉब्लम होवे तो then we say you stop the drug. But gradually, especially children में, हम low dose से शुरू करते हैं और gradually we increase.
Hi, I'm Dr. Ranjana Dhanu, and this time with another episode, but a very interesting one in fact, and we're going to be talking about management of obesity. So I have a very dear friend here who's been my colleague for the last 42 years. We went to med school together, and she's been a very, very reputed and a well-known endocrinologist in the PD Hinduja Khar Hospital, Mahim, and at Khar. And I'm going to introduce to you Dr. Phulrenu Chauhan and then leave the rest to her for her own introduction. So here you have Dr. Phulrenu Chauhan, the endocrinologist.
Hi. Thank you, Ranjana, for making me a part of this very, very fabulous health-related issues, which I think everybody in the world, and especially in all the metro cities, are struggling to face and to deal with. I think Ranjana has been doing a fantastic work dealing with women-related issues, and now she's talking about a global issue.
So I'll tell you why this really strikes me, Dr. Renu, is because my job does not end with just laparoscopic surgery or a minimal access surgery or stress incontinence, which is basically my forte. But I have to see and take a holistic approach towards the patient's well-being. So I start off with patients who are PCOS, and we do know PCOS is affecting 1 out of 4 girls. So there are certain girls who are trying lifestyle modulation, exercise, but how is it that we can assist them with certain drugs which are safe, which will not metabolically affect them? So of course, for their cycle regulation, of course, I'm giving them their cyclical pills, and I'm telling them lifestyle modulation and diet and 10,000 steps. But we do know that we give or we prescribe to them metformin, which is an anti-diabetic drug. And the minute they see an anti-diabetic drug, there is a huge alarm saying, what is this that you're giving my daughter? So will you like to talk about the safety aspects of metformin or glycomet and how beneficial it could be for a patient with PCOD?
While I will be dealing with this particular question a little later on, let me lay down a background that why is it that we are having an epidemic of, or rather pandemic of obesity in this world today. You must realize, and now we know scientifically and through lots of research, that obesity is set or decided, or the body fat content of the body is already pre-decided in the womb of the mother. So what it says is that even before you are out of your mother's womb, the cells which are going to proliferate or multiply to make fat cells is already decided. So unfortunately, we Indians, or rather even some Asian countries, are blessed with certain genes which allow us to put on weight faster than the Western country people. So many people who've encountered or gone abroad say, oh, they eat so much, they eat such large portions, and how come they are not so obese, or why don't they have diabetes the way we do? That is because we are already got those portions of the genes from our parents, and probably it is inherited over multiple generations, and hence we are prone to put on weight. Now, the worst part about obesity in Indians or Asian countries is that it tends to accumulate in the stomach area, around the liver, around the stomach, around the intestine, and that is the fat which we can't see. But by the time the children or the women or men also develop a small little paunch, you won't believe how much of fat has already accumulated inside the stomach.
So by the time the muffin top or the side
Yes.
love handles,
Correct.
or the little lower belly is showing up, there's a huge amount of fat inside as well.
Correct. And also this fat that we accumulate and is not so easily seen as a different kind of fat. It's very stubborn, the cells are big, they are in multiple layers. And for anything to reach that, one needs to treat this entire problem in a different way. Now, the consequences of this bad fat, which is especially, as I said, we Indians are prone to develop that accumulation, is diabetes, blood pressure, cholesterol, heart disease, PCOD, as the doctor has said, and even other life-threatening conditions. So, this fat causes a state of insulin resistance, as we call it, and that insulin tends to create problems in each and every cell of the body. While the children, adults, and other persons look fat, what happens inside is we have absolutely no idea. So as
we have alarming figures about childhood obesity coming through, and most of the urban schools, they are absolutely showing concerns about obesity amongst kids and the kind of lifestyles. Like when we were in school, we had huge playgrounds.
Yes.
Our type of lifestyle was very different. But today, what you see among school kids is a very sedentary life, them on their gadgets, and then the parents being concerned. So how is the incidence of childhood obesity that you are encountering in your OPDs, Renu?
So, Ranjana, unfortunately in Indian culture, if the baby is too thin or if the little child is too thin, so the grandmother or neighbors will say, "Arey, tum to kuch khilate hi nahi."
Yeah, aap dhyan nahi dete ho.
Dhyan nahi dete ho. So I also used to say, "Meri beti to kuch khati hi nahi hai," whereas her health was perfect. So it starts from home. And as you correctly said, our people were different. We had simple food, what was available, variety was not easily available. Our parents were strict and they were very mindful of teaching us or giving us what was absolutely healthy.
Even availability for that
Availability is, oh God, you just step out of the house and just about any kind of food or variety is available. As you correctly said, Doc, playgrounds, climbing trees, falling, running around. Where do the children do that? If at all now there are gyms or whatever it is to reduce weight or to exercise, which we all know is not physiological or it's not natural. So everything is changing. And while you mentioned the metro cities, even in the rural areas, I don't know if you've heard of the Maggie culture. With the exposure of social media, serials going on, children and young adults are sitting at home watching all the advertisements. I have nothing against them. But it is so attractive. It's so easily available. And now people are definitely earning a little more. So it's so easy to go across and buy a packet of Maggi or this and that.
Oh, even ordering in ready food. So
yes.
You see so many families not wanting to really cook over a weekend and say, we'll order in. But they don't understand that comfort eventually is going to lead you to huge issues.
Yes.
And so how and where can we streamline this, and what would your advice be? And I want to come back to certain issues that I face. First, we've started with adolescence and PCOD, and then I'm going to take you to the metabolic syndrome as well, because here we actually want to target how we can get these women with good lifestyles to come down to a good amount of weight loss and lead their lives healthily.
So metabolic syndrome is nothing but it's a syndrome which encompasses many complications. Now, nobody talks about how it happens, but we know that there is obesity, diabetes, blood pressure, heart disease, stroke, uric acid, bone-related
and
issues, thyroid,
resistance to weight loss with thyroid,
and liver disease. Nowadays, everybody is talking about fatty liver and NASH.
Oh, what about the habits?
Oh yes, the habits. It's easily available nowadays because of
alcohol,
pressure.
Smoking on the rise.
So all of that is a confounding factor to cause complications later on in life. So obviously, Ranjana, it's almost impossible to correct the basic layer, that is availability of food, easy availability of food, attractive food, easy, expenditure. And as you said, families nowadays prefer that you order food rather than cook food. So those are some things which are so personalized.
I have one more comment to make about white sugar. Yes. And don't you think that's also a major killer?
Absolutely.
And you have to reduce as much white sugar in your diet right from your childhood. So that's also a very important aspect. And would you like to lay emphasis on how much sugar actually should be permitted to a child, to an adult, or to an adolescent?
So anything that is white, it is said, is harmful, whether it's sugar, salt, maida, what else? Anything that is white which is taken in excess is totally harmful. So within our means, unfortunately, whether it's white, brown, etc., children today at a very, very young age have preconceived notions, whether it is from their nursery, playgroup, friends, birthday parties, and they have their say in the matter. But I would really say that teaching starts in the family. So if family accepts a fact that this is not allowed or does not do it themselves, then obviously it is easier to teach your children and people around that ye
there's a very funny concept we see in Indians, especially कि खाने के बाद थोड़ा कुछ मीठा खाना चाहिए. I think that should be nipped in the bud.
Absolutely.
And if you want, you can probably opt for a fruit, but of course you can't combine fruit with your main meal. You have to take it after a while, maybe a half an hour or 45 minutes. But that thing of taking in something sweet immediately after a meal also should be cut, because it's almost proportional to the number of calories you're taking in a meal.
Oh yes. So just adding to this one piece of mithai, any mithai which has mawa and sugar or whatever else, is about 300 to 400 calories, and that is equivalent to one total meal for a normal individual whose working activity is moderate. So as you correctly said, there is farsan, there is mistan, there are chocolates, there are drinks, so on and so forth. And when we are calculating or advising, or even when people are telling us the food history, they never talk about all these things. Also, what Dr. Ranjana has said, fruit should not be taken along the meals. So if you're hungry in between, a fruit or a salad or something very light is really encouraged.
I always tell my patients to make 30% of their food raw.
Yes.
So you get adequate salads, you're getting your antioxidants, you're getting good fiber, you get the glow naturally. So it's always better, because everything today is about gut health.
Oh yes, oh yes.
Your skin, your bowel, your general attitude, everything is about gut health. So I think it's extremely important. And one more thing is sleep deprivation.
Oh, absolutely. I think that's a very, very, very strong point that you have brought up.
Yeah.
So
sleep deprivation leading to cortisol release, leading to water retention leading to other issues. Yes. So again, I hand it over to you. Yes.
So there is a cycle. Our body is amazing. It's a beautifully orchestrated machine. Sorry to call it a machine, but it is so perfect. And honestly, Ranjana, it takes so much of abuse, till something breaks down. And it gives us repeated signals कि अभी बंद करो, change करो, कुछ तो करो. But obviously we don't pay any attention to it. So ये rhythm, which is associated with dark and light, जैसे the sun sets, it's a signal to our body that all the metabolism, जो भी काम चल रहा है body में, अभी slow down हो रहा है. And unfortunately, Indian families में क्या होता है? Agreed, it's difficult, but the family gathers at night for dinner. We have huge meals and we have the maximum food at night. जो कम होना चाहिए और body के metabolism के साथ धीरे धीरे metabolize या digest होना चाहिए, वो actually rise होता है. फिर जैसे मैडम ने बोला है कि we sleep late, we get up early or we get up late, तो वो पूरा schedule body का है.
Absolutely. Totally. And your digestive system goes for a toss.
Yeah. Totally. And the other thing is, when we are in the mother's womb, ये timing of hormones, enzymes, everything is linked to day and night. So that is not going to change. But if you continuously break that cycle, obviously, जैसे आपने बताया, gut hormones है, cortisol है, दूसरे hormones है, enzymes है, everything goes topsy-turvy. and it causes so many physical, mental, psychological problems which all of us are suffering today.
So let us now focus again, because I'm a gynecologist and I want to grab as much of your time to focus on PCOD. And like I said, I offer to her, she's borderline with her BMI, then I'm offering her diet, lifestyle modulation, exercise, eating smart, cycle regulation, taking care of her cosmetically. But I want to again emphasize on how you can convince a mother of a child who's coming to me at the age of 19 or 20 the safety of metformin.
So as already discussed, हमने बहुत सारा डिस्कशन किया है कि पीसीओडी क्या है, और ये वो उम्र में होता है जब प्यूबर्टी चेंजेस शुरू होता है, तो लगभग समझो 11-12 साल से। आजकल लड़कियों में थोड़ा जल्दी होने लगा है, बट व्हेन द चेंजेस स्टार्ट, अगर वो टाइम पे सिर्फ हाइट ग्रोथ नहीं होता है, वेट गेन भी होता है, भूख भी बढ़ती है, कई हार्मोन्स बढ़ने लगते हैं जिससे ये सब चेंजेस होते हैं। और वो टाइम अगर हमने खाने पीने में ध्यान नहीं दिया, अगर फिजिकल एक्टिविटी बहुत कम है, तो आपने और हमने देखा है कि पेट के ऊपर थोड़ा थोड़ा फैट बढ़ने लगता है। वो लड़कियां है पतली, लेकिन थोड़ा सा टमी दिखता है, पैंट्स टाइट होने लगता है। दैट इज द फर्स्ट साइन कि
then they start to have acne, then they have facial hair. Yes, and metabolically, if you see, there's always a thumb rule that they have either thyroid or prolactin excess.
Absolutely.
Both of them help them, make them worsen the weight gain. Yes. And prolactin gives them a sweet urge.
Yes.
So you have to check on the prolactin, otherwise sweet cravings start off.
Yes. So ये सब टेस्ट तो हम बाद में करते हैं। फर्स्ट वी रिकॉग्नाइज, पेशेंट को देख के ही मालूम पड़ जाता है। जैसे इन्होंने बताया कि एक्ने, हेयर ग्रोथ, मेंस्ट्रुअल साइकिल्स इरेगुलर होने लगते हैं, एंड बहुत सारे मूड चेंजेस। ये टाइम में वैसे भी बिकॉज ऑफ हार्मोनल चेंजेस थोड़ा बहुत मूड स्विंग्स होता है, लेकिन विथ ओबेसिटी एंड जो हार्मोन्स वो गलत तरीके से सिक्रेट किए जाते हैं, वो मूड चेंजेस को बढ़ाता है। तो वर्ल्ड ओवर, पूरी दुनिया भर में ये रिकग्नाइज किया है, बहुत सारे रिसर्च किया है कि इंसुलिन नाम का हार्मोन जो पैनक्रियास में से निकलता है, वो धीरे धीरे उसकी मात्रा बढ़ने लगती है। सो इंसुलिन रेजिस्टेंस यानी क्या? मुझे मालूम है कि ये टॉक सुन के आप लोग सब गूगल यूनिवर्सिटी में जाएंगे, गूगल करेंगे, देखेंगे ये क्या इंसुलिन रेजिस्टेंस क्या है। लेकिन बिलीव मी, एज एंडोक्रिनोलॉजिस्ट, एज गायनेकोलॉजिस्ट, जो हमारी अंडरस्टैंडिंग है इंसुलिन रेजिस्टेंस की, वो टोटली डिफरेंट है। तो इन शॉर्ट, इंसुलिन एक हार्मोन है जो पैनक्रियास, जहाँ से इंसुलिन बनता है, वो बनाता है, और जैसे हम खाने लगते हैं ना, वो रिलीज होता है। तो जितना खाते और ग्लूकोज और फैट बढ़ता है, उतना इंसुलिन बढ़ने लगता है, और उसका काम है कि आप शुगर और फैट को और दूसरे सब न्यूट्रिएंट्स को कंट्रोल में रखें। अभी जब पेट का फैट बढ़ता है, मैंने आपको वो भी बताया कि वो फैट टोटली डिफरेंट है, वो इंसुलिन रिलीज बहुत फटाफट होता है। और बॉडी में ऐसा मैकेनिज्म होता है कि जैसे फैट बढ़ता है, लिवर पे है, फैट पे है, मसल्स पे है, उसका एक्शन कम होने लगता है। यानी उसको जो शुगर को कम करना है वो कम नहीं करता है, फैट को कम करना है वो नहीं करता है, और फिर एक फैटी लिवर जैसा सिचुएशन बनता है और इंसुलिन की मात्रा बढ़ने लगती है। वो इंसुलिन ओवरीज को स्टिम्युलेट करती है और पीसीओडी होता है। पीसीओडी में से, वो ओवरीज में से मेल हार्मोन्स निकलते हैं, जैसे आपने बताया, वो एक्ने, हेयर ग्रोथ होता है, इरेगुलर मेंसेस होता है, और आगे यही लड़कियों को डायबिटीज, आपने सुना होगा प्री डायबिटीज, दैट इज 1 स्टेप बिफोर डायबिटीज, वो सब शुरू होता ही है। मेटफॉर्मिन एक टाइप की मेडिसिन है या ड्रग है, वो हमारे लैंग्वेज में हम बोलते हैं, वो एक ही है जो ये इंसुलिन का एक्शन इम्प्रूव करता है। यानी यहाँ रेजिस्टेंस है तो उसको सेंसिटिव बनाता है, क्योंकि वो उस फैट पे काम करता है, वो जो रेजिस्टेंट है वो बहुत स्टबर्न है। वो लिवर के फैट पे काम करता है ताकि लिवर पे फैट एक्यूमुलेट ना होवे, और जैसे इंसुलिन की सेंसिटिविटी बढ़ती है, उसकी मात्रा कम होने लगती है, और वो पीसीओडी में से नॉर्मल ओवरीज, उसका फंक्शन शुरू होने लगता है। आजकल दुनिया भर में प्री डायबिटिक पेशेंट्स को, कोई भी एज रहे, उनको फुल फ्लेज डायबिटीज ना होने के लिए मेटफॉर्मिन यूज किया जाता है.
Yeah. So, just giving an overview, I just want to say that who's a pre-diabetic, who's a diabetic. So, the glyco-HB, basically glycosylated hemoglobin is the bar or the parameter that we try to assess a patient with. And we normally say today that a patient who is having a sugar level or a glyco-HB beyond 6 or 6.2 would be almost like an established diabetic.
Yeah.
Prior to that, between 5.8 or 5.9 is a pre-diabetic.
Correct.
So this you have to understand in PCOD. One. Second is the hyperinsulinemia in PCOD is going to be benefited by glycomet. Now the main concern is, क्या मेरी बेटी डायबिटिक हो जाएगी अगर ये ग्लाइकोमेट आप दे रहे हो, और बाद में रोकने के बाद मेरी बेटी का क्या होगा, तो मेटाबॉलिकली उसको क्या होने वाला है. सो how safe is it to give glycomet? How long can we give glycomet? What are the tests that we should do to see that she's safe enough to take glycomet? I want you to highlight it.
So that's a very very good question, because सब patients के माँ बाप या grandparents वो पूछते हैं कि why should we give a diabetic medicine to a child who's not a diabetic?
You know, it was so funny, Renu, in the year 2000 when there was this breakthrough about the non-surgical treatment for PCO, which is metformin. So when we started to write this drug, I used to have people calling me like, you know, what is happening, and my 17-year-old and my 20-year-old, you're giving anti-diabetic drugs, and then we have to actually sit down and make them understand and really break the barrier, because we have to actually mass educate so many general practitioners as well about the safety aspects of metformin. Yes. And today you see it's being used so beautifully, and the safety profile is also amazing. So over back to you about metformin.
So we use metformin in young children also, as young as 5 or 6 years. वो लोग बहुत ही healthy होते हैं.
So what would the dose be in a 5 or 6 year old?
We start with 125 milligrams twice a day, and we graduate to 250 milligrams in children. But in adults,
is this dose BMI related, or
no,
how?
How
do you calculate for a child?
No, it's not BMI related. It's a starting dose. It's a low dose, and there are some children or some adults who cannot tolerate. Mild acidity हो सकता है, कभी किसी को nausea हो सकता है, and worst case scenario में वो loose motions भी हो सकता है. लेकिन it is said that you get used to the side effects. और अगर बहुत ही problem होवे, तो then we say you stop the drug. But gradually, especially children में, हम low dose से शुरू करते हैं और gradually we increase. Adolescent girls जिनके periods का time आ गया, उनको हम 250 milligrams से शुरू कर देते हैं, and then we graduate to 500 milligrams twice a day. ये देखा गया है कि Indian population में at least 1000 milligrams of metformin is required to make any difference. Mind you, Ranjana, this medicine is very, very mild. It has no side effects.
Wonderful.
And it is protective. Protective यानी जैसे मैंने बताया, metabolic syndrome, heart disease, ultimately paralysis, stroke is because of insulin resistance. As they grow up, it prevents.
So you know what I have noticed, that if I start off with 500 mg at night, you know, the side effects are much less. And I tell them that you may have a little bit of diarrhea or extra motions, because that extra sugar is getting passed off in your motions, so don't get perturbed. If you have a little bit of nausea, you do let us know. So in the first 15 days, we call them up for a review to see how they're benefiting, and definitely it takes away their hunger. So they come and say, yes doc, I'm feeling less hungry. So that's a positive sign.
Absolutely. So it was recognized कि ये सब तो अंदर ठीक कर रहा है, but it also suppresses hunger. So बहुत सारे लोग बोलते हैं कि अभी भूख नहीं लगती, और cravings, सब लोगों को बहुत सारी cravings होती है, sweets के लिए, chocolates के लिए. Somehow we have found in our day-to-day practice that the cravings definitely go down.
Amazing.
So that's an added value to the medicine. It is very very safe, but उसका मतलब ये नहीं है कि आप किसी में भी शुरू कर दो. जैसे हम बच्चों को देखते हैं, यंग गर्ल्स को देखते हैं, तो पेरेंट्स, मदर विल से, डॉक्टर shall I also take? I said no.
Everything is to be done by medical supervision and tailoring therapy.
Yes.
You cannot just take it as a random prescription कि okay, if she's taking it, her cousin can take it as well, because each one will have a difference in their metabolism. You have to check their liver profile, you have to check their BMI, you have to check their renal profile, you have to see them clinically, and then actually decide whether she's an individual. You have to annually assess them when they're taking the hormonal tablets, because you have to be under medical supervision. So this was fantastic. Now tell me, what is the highest dose that you normally prescribe to a patient with PCOD? You said up to 1000 mg, but can you go higher? And what is the difference between the SR, that is a sustained release, and the routine tablet? And what should you actually choose?
So we generally like to take the sustained release one because it has a smoother action and lesser gastric, like acidity side effects. They are both the same. The one which is not sustained release needs to be given 3 times in a day because uska action kam ghante ke liye rehta hai. Baki smooth rehta hai with a sustained release. We go up to 2000 milligrams. Some people use a higher dose, and it has more and more effect on the appetite as you increase the dose, और वो पेट का fat कम होता है. I even tell my patients that, mind you, this is not a anti-obesity drug, but first you will lose inches. That is remarkable. Inch loss बहुत जल्दी होता है, and inch loss is where we want the fat to dissolve.
Correct.
और फिर secondarily फिर weight loss होता है.
Yeah. So normally what I do, Renu, is I tell them that, look, I'm giving you this drug to assist you in reducing your hunger, but that does not mean that you fill in here and you excrete it from there. You have to be very disciplined. So you have to do your 10,000 steps a day. You have to sleep well, no sleep deprivation. Your habits have to reduce. You have to try and do yoga, and you have to eat smart. And of course, wherever intermittent fasting suits you, if you're doing it, you have to do it under medical supervision.
Absolutely.
Not just blindly follow somebody like a herd mentality and go ahead and do something drastic. So I think we've beautifully covered this aspect of metformin with PCOD. Can we move a little forward now?
Yes.
Because I do see a lot of women in my post-natal or post-pregnancy phase wherein they are loaded with ghee. Because there are some communities that think that ghee should be given to postpartum women up to 10 kilos in the first 3 months, and in a setup like this. So can you imagine what happens when they're super loaded with this? Plus they're all within the house because of the child being totally physiologically dependent on them, and boom, you see them putting on weight. And for me, a patient who's had PCOD, postnatally, suddenly with so much weight, starts off with menorrhagia, heavy bleeding. When you see the sonography, you see endometrial polyps. Why? Because of huge obesity issues. So once they have completed their lactation phase, and of course we tell them that this amount of ghee is not really required, because I always say that this type of nutrition, or the nutrition packed ghee and panjiri laddus, was for women in the past who were catering to a family of 40, not having time to themselves, they were malnourished, and that's when the mother used to come with nutrition packed laddus with dry fruits and a lot of ghee and panjiri. But today, with everything available on the house, if you're loading yourself, you're causing more harm, because that's when you start to see thyroid getting the better of you, and you start to have your glyco-HB which is rising, and your weight also going up, your BMI going up, and you're making yourself more unhealthy. So here is again when we talk about dietary restrictions, and of course once they've completed their lactation phase, then again they can go back to metformin, I'm sure.
Absolutely.
Okay.
Absolutely.
Now we move forward to the metabolic syndrome around the perimenopause, and we do know that PCOD is not going to leave you. Once you're stamped with PCO, you're a PCO for life.
Always.
So anybody from any alternate medicine who's trying to convince you, no, with this therapy we're going to get your PCO off. No, please understand that it is seen in 1 out of 4 girls, and once diagnosed with PCO, you're always going to be a PCO. But what are the issues that you face around the perimenopause? Is you have the metabolic syndrome, wherein you have hypertension, obesity, diabetes, thyroid, cardiovascular issues, and that is where now there's a drug that is actually gaining a lot of importance, and I have a lot of queries coming through for semaglutide. I know it's expensive, but can you throw more light on semaglutide and the safety of semaglutide in handling the metabolic syndrome for women?
Yes, so as Dr. Ranjana has said, that it's a well-known fact that once a diabetic is always a diabetic. Once you have insulin resistance and PCOD, you always have insulin resistance. You can never cure it, but yes, you can control. And while lifestyle modifications is a very, very important part of it, which has to remain for life, we have to take pharmaceutical help in means of medications. One is metformin to a certain extent, but it has its own limitations as far as weight loss is concerned. So there are newer products. One medication which has been in the market for many years is Orlistat. Just a word about Orlistat is that it works in the gut, and it just removes all the fat containing food by means of in your stools. So it prevents the fat absorption and it doesn't do anything else. Of course, because it removes everything in the stools, sometimes you have bloating, nausea,
and patients complain
motions,
of leakage.
oily
So
leakages
that can be
so,
very distressing or socially distressing and embarrassing, because they start to leak fat through the anus if they have a very heavy fatty meal, because orlistat is actually going to block fat absorption from your gut. So that's one of the huge side effects. And then they also suffer some vitamin deficiencies because of the
fat which is being excreted.
Correct. So you have to watch them for vitamin deficiencies. So that is about orlistat. And now my main concern is about semaglutide, and I want you to talk to them about semaglutide.
So a little bit about how it works. See, we all know today that the mind and the gut are related. There is more and more research and scientific data available which says that it's not just gut. Gut पहले समझते थे ये तो सिर्फ खा के digest करके excrete करना है, ऐसा नहीं है. It releases many enzymes and hormones. The gut. आप मुंह से देखो, till the anus, it releases, it's continuously moving, वो तो हम सबको मालूम है, लेकिन साथ साथ हर पार्ट, जैसे स्टमक है, जैसे वो खाने की नली है, जैसे इंटेस्टाइन है, जैसे बिग इंटेस्टाइन है, उसमें से हर किस्म के हार्मोन्स या एंजाइम्स निकलते हैं जो डाइजेस्टिव प्रोसेस में हेल्प करता है. और वो एंजाइम सिक्रीशन का मेन कंट्रोल हमारे ब्रेन में एक सेंटर है, वहाँ से होता है. तो टुडे वी नो दैट ये दोनों लिंक्ड है. So semaglutide is one such medication in market which works on the gut also and on the mind also. It predominantly वो gut के ऊपर काम करता है. उसका काम ऐसा होता है, जैसे मैंने बताया, हर पार्ट अपना gut का कुछ सिक्रीट करता है, कुछ एंजाइम्स है, कुछ हार्मोन्स है. तो जो हार्मोन्स डाइजेशन के साथ लिंक्ड है, सेमाग्लूटाइड उसके ऊपर, उसके रिसेप्टर्स पे, उसके बटन्स को स्टिम्युलेट करता है या दबाता है. जैसे खाना अंदर जाता है वो दबाता है ताकि वो एंजाइम GLP-1 जिसको बोलता है वो निकलता है. That aids the release of several other enzymes or hormones which helps the digestive process and which also prevents hunger. और बहुत अच्छी तरह वो इंसुलिन के साथ काम करता है ताकि इंसुलिन ज़्यादा भी सिक्रीट ना होवे और कम भी सिक्रीट ना होवे, और जितना खाना है वो अपनी तरह डाइजेस्ट होके निकल जावे. एक्सेसिव फूड इनटेक होवे या ना होवे, अल्टीमेटली सेमाग्लूटाइड से हंगर भी कम होता है और डिस्पोजेबल भी फास्ट होता है. अभी जैसे मैंने बताया कि ये गट और ब्रेन का कनेक्शन है. ब्रेन में आप मानोगे नहीं, एवरीथिंग वर्क्स अंडर द कंट्रोल ऑफ द ब्रेन. वहाँ सटाइटी सेंटर है. सटाइटी यानी वो डिसाइड करता है कि बस अभी बंद हो गया. हाँ, आप तृप्त हो गए, बंद करो. प्रॉब्लम ऑफ ओबेसिटी इज दैट पेट भर गया फिर भी अगर हमको अच्छा लगे तो खाते ही जाओ. पानी पूरी, बड़ा पाव, स्वीट्स, चॉकलेट्स खाते ही जाओ. क्यों? क्योंकि ये सेंटर लाइट नहीं होता है, स्टिम्युलेट नहीं होता है. तो ये सेमाग्लूटाइड वो सेंटर पे काम करता है और वो सेंटर में से बहुत सारे एंजाइम्स या न्यूरोपेप्टाइड्स रिलीज होते हैं जो अंदर से गट पे वापस आते हैं और गट को इस तरह वो अप्रोच करता है कि आपका डाइजेशन क्विक होवे और फैट बने नहीं.
सो व्हाट इज द डोज ऑफ सेमाग्लूटाइड?
तो सेमाग्लूटाइड इज अवेलेबल इन 2 फॉर्म्स. वन इज ओरल फॉर्म. हमारे कंट्री में ओरल टैबलेट्स ही अवेलेबल है, वो डेली लेना पड़ता है. जैसे गट पे जो भी चीज काम करता है, वेदर इट्स मेटफॉर्मिन, ऑर्लिस्टैट और सेमाग्लूटाइड, इनिशियली थोड़ा डिस्टर्बेंस होता है. तो वी स्टार्ट विद अ वेरी स्मॉल डोज ऑफ 3 milligrams. There are certain ways of taking it. First thing in the morning with 200 ml of water, और उसके 1 घंटे बाद ही आपको खाना खाना चाहिए या जो भी दूसरे medications है वो लेना चाहिए.
Can I interrupt you here now? Because we have patients who have thyroid issues along with obesity. So can it be taken with the Thyronorm in the morning?
No.
So what if a patient has hypothyroidism and the first thing she's supposed to take is the Thyronorm? So
first thing they have to take is semaglutide. 1 घंटे के बाद Thyronorm और फिर आधे घंटे के बाद अपना चाय नाश्ता या कुछ भी नहीं.
Wonderful.
तो ये एक प्रॉब्लम डेफिनेटली है. तो हम क्या बोलते हैं पेशेंट्स को कि आप अलार्म रखो, सेमाग्लूटाइड पानी के साथ लेके फिर सो जाओ और 1 घंटे बाद थायराइड लो और फिर अपना बाकी का काम शुरू करो.
My next question to you is, can semaglutide be taken along with metformin?
Yes, of course.
Can it be taken along with orlistat?
Yes, of course,
Okay.
because both have different actions.
Okay.
So you can. And 3 milligrams is a starting dose for the gut to get used to it. After a month, it goes to 7 milligrams and then it goes to 14 milligrams, which needs to be continued on daily basis for a long time.
And that long time would be?
Recommended time is 1 year, but I do believe that you can take it for a slightly longer time. But for 1 year, it is definitely safe. Now, हमारे country में we don't have the injectable one. The injectable one also starts with a small dose. It's once a week. That is the best part. और उससे भी side effects होते हैं, लेकिन हफ्ते में लेने से वो side effects.
So what are the side effects of semaglutide? We spoke about metformin saying it would give GI side effects and a little bit of weakness.
Yes.
So what does semaglutide do?
So predominantly on the gut. Acidity, bloating, nausea, vomiting, loose motions. These are the side effects which happen, sometimes headaches. But other than that...
would you attribute all this to the extra amount of sugar falling into the gut and getting excreted?
Partly, definitely. Because it brings about lots of changes with the food that you take. So if you also decide to choose your diet which matches the medication, nothing like it. So diet to साथ में करना ही है. Food, as she said, which causes these things to happen, should be avoided at the same time, and in the long run, it is going to benefit the patient.
See, our quest basically today is what? To see how we can curb that obesity, how we can make women healthier, because there are so many aspects to a woman's day-to-day life pattern. If you see women, they think they have to do their morning chores and then they go and sit down for a kitty. The minute they go into a kitty, they are served all these oily snacks, and there goes their entire morning yoga and whatever they were doing, and their haldi pani and their jeera pani, everything goes for a toss, because at 1 o'clock they're going and hitting a kitty. Then at 4 o'clock they feel hungry, there's a pani puri wala coming at the doorstep, they load themselves with the pani puri. Then in the evening there's a celebration, so there's a cake following that. So I think there has to be some regulation or understanding about how many calories you can consume. So can you just highlight as to what should ideally be the caloric consumption, because we want to make things very simple and lucid for patients to see how they can manage their lifestyles.
So it depends on the age, sex, the type of work you do, the amount of time you spend at home or in front of the television or the laptop, and other comorbidities in the older people. So पहले we used to think हाँ children हैं, खेलते हैं, कूदते हैं, खिला दो, कुछ नहीं होता, और actually ऐसा होता था. हम लोग कितना खाना खाते थे और no time में वो metabolize होके निकल जाता था. लेकिन आज के बच्चे is like the adults, वो खाते रहते हैं but they do not utilize. So अभी भी the standard Indian diet, which is very very good, has about 50 to 60% of carbohydrates, 30% of proteins and 10% of fat. अभी एक दूसरा अलग अलग नॉर्म शुरू हो गया है कि घी इज गुड. Ghee is good to a certain extent and within limits. For that matter, all oils are bad, all fat is bad, but all can be taken within a limited portion. If you follow that, nothing is a matter. Food को attractive और tasty बनाने के लिए you have to put fat. Without fat, nothing is tasty. You have to put color. I have not discussed what color and chemicals are doing to the health of our children today, of the adolescents. There is something known as disruptors. बहुत सारे packaged foods, the plastics, the colors, the imported goods which are there in storage for months together, वो come and disrupt our gut hormones. They disrupt those hormones which are secreted by the ovaries, the testes, and it's creating huge problems which is not looked at. That's
so often we tell our patients that if you're hungry at 4 o'clock, you'd rather have a fresh nashta.
Correct.
So it could be an upma, it could be poha, though it has a little bit of carbs, but it's definitely better than having those chips and those wafers and those other kind of whatever's are available, because those are giving you a lot of extra fats and of course there's hidden sugars in that as well.
Oh yes.
So when we talk about sugar, we're not talking only about white sugar being added onto your tea or coffee, but it's all about the sugars that are going in your desserts, in your different snacks or whatever. So you have to actually see the sugar content of each particular packet when you're actually buying any packaged food.
The one thing I want to tell everybody who's going to listen to this program, that हम जो भी खाते हैं, जो भी except water, सबका ultimately sugar ही बनता है. Fat का 4 गुना बढ़ता है. प्लेन सिंपल शुगर का 1 गुना बनता है, लेकिन अल्टीमेटली शुगर ही बनता है। कई पेशेंट्स आपको भी बोलते होंगे मैं तो शुगर खाती नहीं हूँ, लेकिन बाकी सब कुछ खाते हैं जिसका शुगर बनता है। तो फूड इज शुगर।
I don't eat sugar but I have cake.
Yes.
So that's a funny one.
Yes.
And you know, people have some people like to add a little bit of sugar in the dal or in the roti or in the sabji. So even that amounts to a little bit.
Yes.
So what is your opinion about Stevical or giving sugar substitutes? Or what do you feel? How much should be, or allowed? How much is good, or how much should be allowed?
Bare minimum. I mean, there are lots of things going in the media, newspaper, that this is bad, this causes cancer, etc., etc. I think only the older products which were not researched properly perhaps had these side effects. The sweeteners and the supplements can be taken, but sab mein mat dalo. 2-3 chammach ya 2-3 tablets, just enough to give you that flavor. So, आप चाय में, कॉफी में, मिल्क में डाल सकते हैं, or you develop a habit of having without sugar. Yeah, very little crystallized sugar is also fine, but everything in excess is bad. So that should be totally avoided.
Getting you back to semaglutide, can you tell me the cost of the tablet and what a patient would be spending over a month if she's going to be taking this as a weight loss therapy?
So semaglutide is very, very expensive. About a tablet, whether it's 3, 7 or 14 milligrams, cost does go up a bit as the strength goes up. It's about 400 rupees per tablet.
400 rupees a tablet. Well, that's steep.
That's very steep. But considering the problems that you are going to face because of obesity and the complications that you have to deal with, and the financial crunches which we see our patients dealing with diabetes, heart attack, hospitalization, kidney disease.
So here we can highlight, young girls, rushing towards bariatric surgery, and that's scary. Absolutely. The number of people who are wanting to run under the knife just to gain or optimize their weight is crazy. So I think in such patients then, a drug like this would definitely play a certain role. But of course, again and again, we both have that there has to be diet, lifestyle modulation, exercise, and you need to take care of your daily routines and only then take these drugs. You cannot just take these drugs for granted and sit with a sedentary lifestyle.
Absolutely, I agree with you fully. One thing I also want to say that the patient often says, ये बंद कर देंगे तो वजन वापस तो नहीं आएगा ना. अगर आपने डाइटिंग किया, रेगुलर एक्सरसाइज कंसिस्टेंटली किया तो नहीं आता है. लेकिन सपोज यू डिपेंड ऑन द मेडिसिन, वेदर इट्स मेटफॉर्मिन, ऑर्लीस्टैट, लिराग्लुटाइड और सेमाग्लुटाइड, only on that, and if you don't put an effort, of course the weight is going to come back.
So what we can say is take assistance of these drugs till you reach a certain target.
Yes.
And then you get on to your lifestyle and see to it that you can go on a maintenance without these drugs.
Absolutely.
So only take it to optimize your weight, and everybody knows at what height and what weight you should be, what height and what age you should be having your weight, and continue to follow that particular lifestyle or that particular pattern. Is there anything else that you would like to give as a take-home message with your extensive experience as an endocrinologist, seeing huge number of patients? She sees more than 100 patients who are diabetics or having thyroid issues every single day. So I think when she's seen so many patients, there should be a certain take-home message from Dr. Phulrenu. And I'm so happy we work as a team, because for me, my patient post-operatively to be metabolically fit is equally important, because if I'm operating on a diabetic and tomorrow her wounds don't heal, they're going to suffer. The patient is going to come back to me with huge complications. So we actually need them to tailor treatment for them till the next 6 to 8 weeks post-operatively, and that is how we work hand in hand. So what's your take-home message for them today?
So obesity doesn't happen overnight. It comes very, very slowly and it keeps building. And if we don't recognize that and put a stop to the cause of obesity, it is going to continue. To reach, say, to put on an inch or to put on 2-3 kilos, it might take 2-3 years. So do not expect कि weight loss, अभी डॉक्टर के पास गए, अभी ये डाइट खाया, अभी ये किया, अभी ये जिम में गए तो weight loss होने वाला है. नहीं होने वाला है. For the body to recognize, especially the centers in the brain, for that center to be switched on, it needs consistency. So if you consistently work out, if you consistently diet, and believe me, both Dr. Ranjana and myself, we encourage cheat days, because ऐसा भी ना होवे कि कभी sometimes you get frustrated and then you start binging. So cheat days को accept करके वो cheat days को आप कुछ भी कर सकते हैं, लेकिन by and large consistent exercise,
discipline. I think discipline is extremely
very
important.
and it has to be long term. नहीं तो believe me, especially we as Indians are going to land up with lots of complications very early, in very early age.
Yeah. So just to sum up now, let me just say that you can probably use metformin, or you can use orlistat, or you can use semaglutide, but definitely with medical supervision. The safety window of these drugs is pretty good, but you need to be tailoring this treatment under some supervision and not just taking it off the counter, and understand that this particular session that we've done is not pharma driven at all. We at the Hinduja Healthcare have taken this initiative of just educating the masses at large in order to see that we have a healthy society, and I hope we've gotten the message across to you, and we wish you all the best. And of course, for any further opinions, we're always there at the Hinduja Hospital to assist you in any form that you require. With that, we wish you all the best and thank you.
Thank you. Thank you.